Cervical cancers are very common, especially in developing countries, and yet it is one of the cancers that has a screening test. It has a vaccine, and because of that, in reality, cervical cancer shouldn't be a big deal. Cervical cancer screening generally is supposed to be done regularly. There are three main types of cervical cancer screenings. We have the HPV DNA, which is a more reliable test because you're looking at the actual exposure to human papilloma virus. HPV is a human papilloma virus which causes the cancer. And then there is a Papsmear, which is also a bit more reliable, but the sensitivity is close to about 65 to 70%. And then you have visual inspection with acetic acid, which has a very lower sensitivity and specificity because it is somehow also the provider dependent based on how the person who is doing it visualizes the cervix. Cervical cancer screenings are done every 5 years if you're doing the HPV DNA. If you did that and they've not got any, that you do not have any exposure to the HPV, therefore you will repeat it after 5 years. If you've done Papsmear, usually it is repeated after every 3 years. And the same with the visual inspection with acetic acid. But generally speaking, if you have any condition that compromises your immunity, such as those who have HIV, those who have conditions like diabetes, or those who have cancer treatment, or if previously you did a Papsmear and it was showing that you are having either suspicious lesions, or in most cases they can indicate that you are having you're having cervical changes of unspecified significance. In a situation like that, you may need to do the test more frequently. So that is how cervical cancer screening is done. It is a very simple procedure. It does not take long, and therefore I encourage everybody to be able to do a cervical cancer screening, because there's no reason for somebody to die because of not doing a screening, and yet the diagnosis could have been got early. And then also currently governments are giving out the vaccines to those who are not exposed. There is a benefit for those who have been sexually exposed to be able to take the HPV vaccine, because the vaccine is not only useful for strains of HPV which only causes cervical cancer, but also the other cancers that somebody can be exposed to. So there's still benefit, especially for those who are below 26 years, to be able to use the vaccines. Technically speaking, having HPV does not mean that you have cervical cancer, because oftentimes I get mothers who have been tested positive for HPV DNA, and then immediately they are declared to be having cancer. HPV is a very common virus, which is most times sexually transmitted, and naturally also the body is able to clear it. That's why we don't do HPV DNA test for younger ladies, especially those below age of 31 years, because we generally know that having an exposure to HPV can naturally, the body can also be able to fight back and clear off the HPV. So it's very important that we have to do cervical cancer screening early, because usually cervical cancer changes take a long time, usually from 1 year to over 10, even to 15 years before somebody actually can be able to develop cancer. So when you do screening regularly, you would be able to identify the cervical cancer changes early, and that way you can be treated, especially if If the cancer is confined within the cervix, it will be extremely very easy for you to be treated, and therefore it's very important that everybody should be able to do cervical cancer screening. Thank you.